GoDocGo is an international medical organization working to establish cervical cancer screening programs around the world. It was founded in 2013 after a trip to Ethiopia raised Dr. Maggie Carpenter's awareness of the need for such services. This April, a team from GoDocGo returned to Ethiopia. The first project began in October of 2014 at the University of Gondar Hospital in Ethiopia. The hospital is a tertiary hospital and training center for residents and medical students. It draws from a catchment area of over 1 million people. During that initial visit, the doctors, OBGYN residents, students, and nurses were trained in a simple method of screening for cervical cancer called visual inspection with acetic acid, or VIA. GoDocGo also brought brand new cryotherapy and LEAP machines and trained the doctors in their use. During the very first year, they screened over 1,000 women and treated hundreds. Since then, GoDocGo has continued to support the screening program and has sent multiple shipments of supplies to the hospital. On this visit, we toured the new outpatient center and were thrilled to see the original equipment in excellent working order and to hear that they are screening over 1,500 women per year at the center. At this visit, we also donated a thermocoagulation machine, which is as effective as cryotherapy for treatment of precancerous lesions, but much more portable, less time-consuming, and easier for both patients and healthcare workers. The team toured the entire hospital, including walking by the pathology department, which triggered the original idea.
In 2011, when I first came to Gondar, Ethiopia, arranging a residency exchange with Seattle, I got a tour from an OBGYN who took me right by this department. And when I said pathology department, I said, "Oh my goodness, is that where you do your pap smears?" And he looked at me and said, "We don't do pap smears." I said, "Well, what do you do for cervical cancer?" "We don't do anything." And I said, "So they present when they're really late advanced disease?" And he said, "Yep." So then it took about 1.5 years to kind of research what we could do, and that's how I learned about VIA. And finally came back in the fall of 2014 to bring a LEAP unit and a cryo unit and train them in doing VIA. And so it's now 2019, it's been 4.5 years, and we just saw their lovely unit where they are doing over 400 screenings every quarter. And the LEAP unit is in good shape, the cryo unit is in good shape, the colposcope unit we donated is there being used, and it's a success. So we just have to keep doing more.
The team also established a new program in the second largest city in Ethiopia, Adama, a sprawling city about half an hour southeast of Addis Ababa. Despite its size, the hospital, which has OBGYN residents and 1,800 medical students, does not have a regular screening program, and most of the women examined had never been screened in their lives. GoDocGo provided them with a thermocoagulation machine, so they are now able to both screen and treat women. They provided registrars for keeping track of the patients they see and their results. If the hospital shows a commitment to cervical cancer screening, GoDocGo will provide a LEAP machine. GoDocGo's program in Senegal continues to grow. This year, a team established new programs in Rufisque, a suburb of Dakar, and in Medina Gounass and Vélingara, rural outposts. The entire team donned headwear for the trip to Medina Gounass. In June, a team is heading to 2 new hospitals in the southern Casamance region, along with a repeat visit to a remote health center and a new visit to a small village in eastern Senegal. They will be training the doctors, nurses, and midwives in VIA and thermocoagulation. These trips are organized in conjunction with our partner, La Corsa, an NGO that establishes health, education, arts, and agricultural programs throughout Senegal. La Corsa's support and knowledge on the ground has been invaluable to GoDocGo. In the Gambia, Dr. Carpenter and Patricia Bacon visited the Edward Small Teaching Hospital in the city of Banjul. They screened 63 women and brought a thermocoagulation unit. The doctors and administration in Banjul were warm, encouraging, and excited about broadening their current program. In Haiti, working with our other partner, Hands Up for Haiti, a robust cervical cancer screening program has been established in Limbe over the last 2 years. They have seen 2,000 women and treated 170. At this time, the program is self-sufficient and we will be available for additional support as needed. Our program director, Patricia Bacon, has been instrumental in the growth of GoDocGo over the last year. Omar Balde, our in-country director in Senegal, has also been a huge asset, helping expand our presence there while navigating required bureaucratic systems. GoDocGo's success relies completely on donations, and we are always looking for interested foundations or grant opportunities. Thank you for your ongoing support.